The new Trump budget means huge cuts to healthcare. How will this affect the caring economy, including nursing homes, assisted living, and in home caregiving, which is almost all paid for by Medicaid? Welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202 838 6837 and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's show. In today's episode, healthcare expert Nicole Jorwic tells us more about how Medicaid cuts will affect people needing care and people giving care. But first, I want to welcome Diane Archer from Just Care and Social Security Works to talk more about Medicaid. Welcome, Diane.
Thank you, Laura. I'm happy to be here.
Let's start with how you got involved with Medicaid policy. What got you interested in Medicare?
Oh, that's a great question. I got interested back in 1989 when there was a lawsuit brought against the government on behalf of physicians that was claiming that the explanation of Medicare benefits form was gobbledygook. And the ruling was from the Eastern District of New York, the explanation of Medicare benefits form is gobbledygook. It needs to be written so people understand it. And the lawyer involved in the case thought there was a need for an organization that focused exclusively on patients and not physicians, and asked me if I wanted to raise money and run a nonprofit that would help people navigate Medicare. And that organization is still around, and it's called the Medicare Rights Center. And people can call with their questions for free, get answers on their hotline. I think the number is 1-800-333-4114 if you have a Medicare question or problem, particularly Medicare Advantage problems. And that organization also does some education work and policy work. But since then, I moved on. I worked on the Affordable Care Act. And I then began working with Social Security Works, as you mentioned, on health insurance and healthcare policy more broadly.
And I think it's important that we're here answering people's questions, but also that we have personal experience. Like I have had an insurance policy through the Affordable Care Act for over a decade. And Louise, our Affordable Care Act expert who's on vacation, she also has a policy through the Affordable Care Act for herself. And so you benefit from Medicare, right? You are not only an expert, but you also use it.
I guess my age is not a secret here, but I do. I recently went on Medicare. So I have gone through all of the hoops and challenges most people have to go through. Almost everybody has to go through now. It used to be very simple. It used to be that you were automatically enrolled in traditional Medicare. Actually, you still are. But you didn't have a choice of Medicare Advantage, so it was much less confusing. And traditional Medicare, for those who don't understand, is a government-administered program that covers your care from almost all doctors and virtually all hospitals across the country. So you need care, you go to the doctor, you get your care covered wherever you happen to be, if you move around, if you travel, if you have family elsewhere, wherever you are, your care is covered in these United States. Medicare Advantage came into being in 2003 or 4. I can't even remember now. Before that, there were some HMO options, and Medicare Advantage is basically a program that lets people enroll in what is effectively a Medicare HMO, a health maintenance organization that limits the care you get in terms of the doctors and hospitals you can use. Usually it's limited to your community, but sometimes if you're in a PPO or preferred provider organization, sometimes you'll get partial coverage outside your community. And then also has strict rules around when it will cover your care. So while the Medicare Advantage plans are required technically, legally, to cover all the same Medicare benefits as traditional Medicare, the government administered program, they put in additional challenges and obstacles to getting your care covered, primarily prior authorization, which they use as a tool to decide whether care should be covered, and that can result in inappropriate and harmful delays to your care and inappropriate and harmful denials of care. And you do not have that in traditional Medicare. And in addition, in Medicare Advantage, they limit the doctors and hospitals you can use. Sometimes you can see the doctors you need to see, other times you can't. You have a special rare form of cancer, and that cancer center of excellence that you need to go to is not in the network. And so what we find is that Medicare Advantage upfront can look like a good deal because upfront costs are often non-existent. But once you need costly healthcare services, it can actually end up costing you a lot more than traditional Medicare. It can cost you, in some cases, your life.
Mhm. And it's not easy for people to choose, what is the best plan, right? Especially for Medicare Advantage, that there's star ratings, but those don't necessarily mean a whole lot.
Good question. Great question. So how do you choose the right plan for you? I think you just nailed it. It's not only not easy to choose the plan that's right for you, it's impossible. And that's sort of where the problem lies with Medicare Advantage, because you have no clue which plans in your area are engaged in widespread and pervasive inappropriate delays and denials of care. Although the HHS, Health and Human Services, Department of the Office of the Inspector General has said that many plans are engaged in widespread inappropriate delays and denials of services, but you can't avoid them because you don't know which ones those are. You can look at the star ratings, and you can avoid the plans that have 1, 2, or 3 stars, because that means they really aren't performing well at all. But unfortunately, the plans with 4 and 5 stars also might be not performing to the standards you need. Unfortunately, the government doesn't capture which particular Medicare Advantage plans are denying care inappropriately, and doesn't capture which Medicare Advantage plans may have inadequate networks. Technically, they're supposed to have adequate networks. Technically, their provider directories are supposed to be accurate. But again, reports show over and over again that the provider directories are very misleading, that you cannot count on seeing the doctors and using the hospitals in the provider directories. You have to actually check with individual doctors and hospitals to make sure they're in the Medicare Advantage network. And then there's another problem, which is, unfortunately, Medicare Advantage plans can be ever changing, and providers in a network in January might be out of the network in February, or in the network in March might be out in April. And so you have just no way of controlling whether you'll have continuity of care in a Medicare Advantage plan, which is obviously a serious concern for anybody with a costly health condition. And for anybody who is healthy, it's really important to have health insurance that's going to be there for you if you get sick. That's what health insurance is about. I mean, we all are, or the vast majority of us are healthy at any given time. And then like that, like you've experienced, right? I mean, you get a diagnosis that you can't imagine, and then all of a sudden you're pulled into the healthcare system, and you really can't afford to wait to get care. And you certainly can't afford to have your care denied when your treating physician says you need it. And sadly, that happens all too often in Medicare Advantage.
Exactly. A car accident, a heart attack, a stroke, a bad diagnosis. You can't always see these things coming. And so the idea that you have the time to shop around and find the right doctor is unfortunately not the case. So, why doesn't the government do more to rein in bad Medicare Advantage plans? Because they should not be taking taxpayer dollars and denying care.
It's such a good question. And I think, unfortunately, the answer lies in the fact that the insurance companies offering Medicare Advantage have more power than the federal government. And the federal government doesn't have the resources to take on the plans that are not doing what they are contractually obligated to do. They're violating their obligation to cover people's care. And so, yes, I just read actually today that the Trump administration has imposed, I think, already $3 million in fines on Medicare Advantage plans for not performing the way they should by overcharging their members, for example. But that's probably just a drop in the bucket of all of the different problems. And what happens is the government comes in, they audit, they see that people aren't getting what they're entitled to. And then if they try to sue, the insurers sue back, and all of a sudden there's litigation. And unfortunately, the older adults and people with disabilities and Medicare Advantage can't rely on the government to make sure that their insurers offering Medicare Advantage are actually complying with their legal obligations.
And this sounds like something that Congress could take action on if they wanted to.
That's very true. I mean, there are rules out there, for example, for transparency and accountability in Medicare Advantage, and they're not being followed by the insurers. And Congress could impose very strict penalties on these plans, pushing them out if they don't follow their obligations, but they haven't as of yet. And so I guess, my belief is that what we need for people is an affordable traditional Medicare option, because right now people have to pay for Medicare supplemental coverage in order to be in traditional Medicare and not feel like their out-of-pocket costs are out of control. So that would be a huge help. And then Congress needs to make sure that the resources are available to oversee these plans a lot better than is currently the case. And so I advise people, if you're in a Medicare Advantage plan or you're in a traditional Medicare program, you should be contacting your members of Congress if you're unsatisfied, if you find that supplemental coverage in traditional Medicare is too expensive, and you think that, like Medicare Advantage, traditional Medicare should have an out-of-pocket limit. You should let your members of Congress know that. And if you're in a Medicare Advantage plan, you should be letting your members of Congress know that you need them to make sure that the insurers offering Medicare Advantage plans are being transparent and are accountable for any bad acts that they undertake.
And this administration, if they wanted to, if they chose, they could also have more oversight over Medicare Advantage with existing laws, right? They could do more to protect seniors on Medicare Advantage plans. But unfortunately, with all the cuts at HHS and so on, it seems unlikely that there will be the staff or the will to do anything to protect seniors here.
Good question. So there was a report maybe a month ago, that indicated that HHS, CMS, the Centers for Medicare and Medicaid Services, was going to hire a lot more auditors to oversee the more than 4,000 Medicare Advantage plans on a regular basis. And that's very good news. However, it's not enough, because it's not simply about the auditing. It's about penalizing them for their bad acts so that they don't feel like the punishment is worth the crime of not providing people the care they need. And I think right now the penalties are so low that it's just the cost of doing business and they keep doing it. Moreover, after the fact oversight is not going to protect people except, after the fact. We need rules in place so that people are protected when they need care.
Thank you, Diane. And we'll be talking more about Medicare next week as well. So keep giving us your questions and we will keep getting you answers. And now I am pleased to introduce Nicole Jorwic, the Chief Program Officer at Caring Across Generations. Welcome, Nicole. Welcome back.
Thanks, Laura. Glad to be here again.
So let's start by talking about what is Caring Across Generations, since we've had you on a few times, but people may not know much about your organization.
Yes, Caring Across Generations is a movement of family caregivers, care recipients, so disabled folks and seniors who rely on care, as well as care workers who are working together to build a movement to build the care systems that we all need, and also to change the culture and narrative around care in this country.
So we have been talking for many months about the cuts that could happen, and now the cuts that did happen that are now law. But can you tell us about what Caring Across Generations is doing to fight back against these cuts and what people watching and listening can do?
Yeah, definitely. So we, as I think I've been talking about since right after the election, when we spoke then, sadly, I wasn't Chicken Little. The sky was falling, and they did pass the massive cuts to Medicaid. And that included cuts to Medicare, as was being discussed. So $1 trillion in cuts to Medicaid, $500 billion in cuts to Medicare. And so now what our role and what we need to do is make sure that anyone who voted yes on this piece of legislation is held accountable for the result of what that legislation which will come with body counts and also will come with bringing systems down. And so that accountability can start and needs to start now. And that's because we're actually coming up on the 60th anniversary of these programs. So July 30th marks the 60th anniversary of Medicaid and Medicare becoming law. And so we knew that no matter where we were in the current budget bill fight, which unfortunately we did see it pass, that we needed to be out there and highlight all of the different ways that 80 million people are impacted by this program. So starting on July 23rd at 9 p.m. On the National Mall, we are starting a 60-hour to note those 60 years, a 60-hour Medicaid vigil, where we will be sharing stories. We also have faith-based, a prayer service one night. We have a community table conversation where we will make sure that all of the different communities that will be impacted, from rural communities to those faith-based communities to disability communities, will be coming together. And that will go until 9 a.m. on Saturday, July 26th, which is also the 35th anniversary of the Americans with Disabilities Act becoming law. And we will see that last hour, the closing rally, we'll see a lot of disability advocates and also a lot of children who, because what that will be is that pivot point at 9 a.m. we close the 60-hour vigil, and then Caring Across Generations, along with partners all over the country, are planning Families First events. We have over 200 scheduled, and on that same spot on the National Mall that will be ending the 60-hour vigil, we'll be coming together to say that for family caregivers, for disabled children and adults and seniors, that we have this intergenerational need, and that we need our legislators to be putting their families first, and that these cuts to Medicaid and cuts to SNAP and cuts to the ACA and these immigration enforcements are not putting our families first. So we're coming up on a big week of a lot of activities. We have the 60-hour vigil. You can look at protectmedicaidvigil.org to find out all information, because it will also be live streamed. And then on July 26th, if you go to familiesfirstnow.org, you can look up local events in your area. You can come join us in DC. And there's a lot of opportunities to raise our voices and say that these cuts, even though they passed, we can start asking for them to be repealed. We can start asking for the legislation that our families need and that family caregivers, disabled people, and seniors and everyone all over this country deserve.
Thank you, Nicole. And these cuts, this bill is law, but some of these cuts are off in the future. So it is that much more important for people to speak out now and tell their representatives that they're upset, concerned, frightened that this affects you and your family and you want them to fix it, right? Because some things are happening right now, but some things will happen over the next few years. And there are things they can do to help ameliorate the harm that they've caused.
Absolutely. Because of the massive amount of advocacy and all of the work that so many people did to really elevate the problems and the risks of these massive cuts to Medicaid, they actually push those out in time. So that means that actually they're not going to go into effect until 2027 and 2028 in some cases, depending on which of the kind of wonky Medicaid cuts that we're talking about. But that does not mean that that's when the pain is going to start. And what we need to do as advocates of Medicaid and healthcare advocates is to say that we know that the special sessions are being called in the states because of the states are going to have to grapple with these cuts, massive cuts to federal dollars. Those special sessions are getting scheduled right now. We also know that that in Nebraska, it was already announced that a community health center was going to have to close. We're going to see the rural hospitals and the rural nursing homes and adult service programs going to start to close because of the uncertainty. Even if the date is pushed back, we're going to see the pain, and we need to elevate that so that those who made the votes to approve these cuts see that and can't keep making decisions that harm their constituents and harm people on Medicaid.
So what people can do is they can go to those two websites you mentioned, and there are they can watch from home, but there's also going to be actions that people can attend in their own areas, right?
Yes, absolutely. Especially on Saturday, July 26th. All over the country, you can go to familiesfirst.org and find in your communities. Some of those are going to be at hospitals. Some of those are going to be in parks. And they are going to be these intergenerational, family-friendly days of protests where you can find them. It'll be noon Eastern, noon all over the country, meant to be family-centered. We have some that are having circuses. Again, highlighting the fact that we can come together as families and as communities to say what our families need. And a big centerpiece of that is protecting Medicaid.
Thank you, Nicole. I think perhaps it was too easy for some of these legislators to vote against people in their own districts because they didn't have to see them. They didn't have to hear their stories. And so it's that much more important in the next couple of years as these cuts take effect that they see us and that they have to listen to us, right?
Absolutely. I mean, we're seeing some more news stories come out, the USA Today, New York Times in the last couple of days, talking about the ways that these bills will impact the disability community. And it's really important that it's not just on newspaper pages or even online, that when these members go back to their districts, go back to their home states, that they do see the faces of the people that they just betrayed with this vote. And that's why we are starting off Families First. This is the first weekend of August recess. Both the House will be done on Thursday and the Senate goes out on Friday, which is why we're kicking off with this accountability on behalf of our families and for the systems and including the care economy that everyone in this country needs.
I think people may not really understand the term care economy. Can you talk about what that means so that people have an understanding of how this Medicaid cuts is going to affect everybody one way or another?
Yeah, absolutely. So when we talk about the care economy, we're talking about all of the different ways that those community health centers, hospitals, the service system that supports people and supports family caregivers is actually an economic driver. And that when you're having massive cuts, that is going to be a cut to local economies and also to family economies. Because we already know as a country, part of the care economy is individual families and individual family budgets, because we know, according to our friends at the National Partnership on Women and Families, that over $1.1 trillion is provided to the economy by unpaid family caregivers. And so the care economy is all of those family caregivers who are spending money to provide the supports that the current system doesn't cover, in addition to all of the different ways that hospitals and community health centers are contributing to local economies. And ultimately how all of it is an economic driver that needs to be addressed. And a lot of that means supporting the threadbare systems that exist and certainly not shredding them, which is what has been done this month.
Home and community-based services was not properly funded even before this bill. I know that we were talking about this a few years ago, back during the Build Back Better days, where there was a push to put more money into home and community-based services so that people with disabilities could live in their homes. And if you don't want to live in a nursing home or assisted living facility, that you can be at home with the support you need to make that choice. So it wasn't funded in the first place. There are many year-long wait lists for Medicaid services in many states. And now $1 trillion hatchet has been taken out of Medicaid. What is this going to mean for people?
Yeah, I mean, when you talk about the care economy and you talk about specifically the infrastructure that is home and community-based services, these cuts of $1 trillion are going to have an outsized impact on that system. And that's because home and community-based services are an optional service under the federal law. Nothing in the bill that was passed and signed into law on July 4th by President Trump changes that. And so that means when states are going into these special sessions and when states have to make cuts to the program because of the cuts of federal funds, the first place those are going to come is to home and community-based services. And that means that provider rates that are already really low for things like adult day centers and job coaching services for people with disabilities, those are going to be cut even more, be cut even further. That means that direct care worker wages that are already astronomically low, and this is a workforce that is in massive crisis, those wages are going to go down because those are the cuts and those are the decisions that states are going to have to make with the cuts from the federal level. And so, yes, before the bill even passed, there was over 700,000 people on waiting lists. We're going to see those waiting lists grow, frankly, exponentially. And we know that some programs are just going to have to close overall because of cuts of this size. And layer on top of that, the amount of money that states are going to have to spend to live up to and abide by the requirements for things like constant eligibility checks every 6 months and work requirement checks. Those are going to be massive systems that states are going to have to create that will cost money. So they're going to have to cut and they're going to have to cut again. And a lot of it's going to end up impacting disabled people and seniors and home and community-based services.
Mm-hmm. And when a nursing home or assisted living facility in your community closes, that is pretty obvious. You see a building filled with people, and then that building is shut down, and those people need somewhere to go. But I think that the home and community-based services piece, people may not see those cuts as readily unless it is impacting your own life. But this is every bit as much of a crisis as the more visual one of nursing homes shutting down, right?
Absolutely, because the reality is that when these services are shut down, that home care worker who is just providing enough support to allow a family caregiver to work and to take care of their basic needs, that means that responsibility is going to fall back on that individual family caregiver. And right now, families, there is a requirement for nursing home services, but then you're going to see nursing home services. People don't want to go there. We know 90% of older adults and 95% of disabled people want to be in their homes and communities. But with these cuts, You're going to have cuts to those home and community-based services, to those threadbare supports that families and people rely on. And then there's no backdrop either because the facility-based services are going to close. But the biggest impact is going to be on the lives and independence and health and well-being of people who are currently receiving services, who are going to get less, those waiting who are going to get nothing, and those coming up behind who knows if we're even going to have a system to rely on.
So this is a crisis, and everybody listening should make sure to participate in the Caring Across Generations and Coalition events this coming week, but also in the future, because one day of action is not going to solve the problem. We are going to have to be out there until they hear us and until Congress does something to solve the problem that they just created.
Absolutely. Absolutely. We need to be out there. We need to be sharing our stories. And most importantly, we need to be holding accountable the folks that voted for this and making sure that everybody who wants to represent us understand how important Medicaid and healthcare and the care economy is to the over 105 million people who are providing care, and the millions of disabled people and those with chronic illnesses all over this country who are, I know, in a lot of fear right now. That's why we have to keep fighting every day.
And one final thought, if we were in a brighter day, which hopefully someday in the future we will be, what should we be doing to make home and community-based services available to everybody who wants and needs support, and to support caregivers, whether they're paid or unpaid, in the entire care economy?
Yeah, I mean, the way that we will get to those brighter days, and that's why, in addition to the defense and accountability work and trying to get repeals of these bad cuts, we also have to talk about the fact that the system wasn't perfect to begin with. And so build a system, build a care economy that is so strong that care can be a choice for those family caregivers, and ultimately that you're investing in home and community-based services at the same rate of people who want it. There's no state all over in any place in this country that is paying for in their long-term care pot of funding 90% for home care. So we have to look at flipping the bias towards home and community-based services. And there are pieces of legislation for that, including the HCBS Access Act, that we can get passed to make sure that nobody has to wait for services. But it's going to be hard to get investment until we can shore up the program that just got gutted.
Thank you so much for joining us, Nicole. And thank you for everybody joining us today, learning about what these attacks on the caring economy are going to mean for all of us. Please text or call in your health insurance and healthcare questions to 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America. Be sure to subscribe to my channel or podcasts wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.